Mix FM Snapshot with Dr. T. Sweet Peng, fertility consultant from Metro IVF.
What are the challenges when it comes to a woman trying to get pregnant after the age of 35?
Women after the age of 35 would have decreased number of eggs, and the egg quality would also be poorer. And this will make her fertility rate to be lower than the normal. For example, if she's 25 years of age, then her chance of getting pregnant is 30% a month. If she is 35, then become 20%, and if she's 40 years old, become 5%.
Why is this the case though?
When the woman is young, she has about 200,000 eggs in both the ovary, and every month, about 30 eggs will be used for maturation and wasted if she don't get pregnant. As her age increases, then her fertility will drop. So as she grows older, there will be less number of eggs remaining in the ovary. So when she reaches about 50, all the eggs would have gone, and there will be no more eggs available for her to get pregnant.
Mix FM Snapshot for Metro IVF. Mix FM Snapshot with Dr. T. Sweet Peng, fertility consultant from Metro IVF.
When should a woman above 35 years of age seek fertility treatment?
Normally, a doctor will advise a lady to seek fertility treatment if she has been trying for about a year. But 35 years and above, will advise her to seek treatment earlier, 6 months after of trying. There are a few reasons why we ask her to seek treatment earlier. Now, one is she has limited fertility time, and she may want to have 2 or 3 children. The other reason is if she waits longer, then her cost of treatment will go up. The drugs used for stimulation of the eggs will increase, and she will have to undergo more investigation. And if she gets pregnant, then she have increased risk of miscarriage, more pregnancy complication because of high age, and also more chance of getting abnormal babies. So it's very important for the lady to seek treatment earlier.
Mix FM Snapshot for Metro IVF. Mix FM Snapshot with Dr. T. Sweet Peng, fertility consultant from Metro IVF.
What are the chances for a woman conceiving after 35, chances with IVF?
The chance of conceiving naturally for a woman is 30% at 25 years of age, 20% at 35, and 5% at 40. If she were to go for IVF, the chance of getting pregnancy will be 60% if she's below 30, 40 to 50% if it is 30 to 40 years of age, and about 20% if she's above 40 years of age. So it's better whether she's going for natural pregnancy or IVF, she should attempt pregnancy as soon as possible.
Mix FM Snapshot for Metro IVF. Mix FM Snapshot with Dr. T. Sweet Peng, fertility consultant from Metro IVF.
I've heard of 60-year-old women getting pregnant. Is that possible?
Yes, using donor eggs.
So what about using her own eggs?
So far, the oldest woman who ever get pregnant in IVF using her own eggs is 46 years old. She's Belinda from Orlando, USA. She conceived at the age of 46 and delivered a healthy baby boy in the year 2013. In Malaysia, we have one such case, a 46 years old lady who had IVF in Klang and successfully got pregnant with her own eggs. And she delivered a healthy baby girl at the age of 47 in September 2014. These cases means that ladies in the late 40 years of age still have a chance to get a baby of her own.
Mix FM Snapshot for Metro IVF. Mix FM Snapshot with Dr. T. Sweet Peng, fertility consultant from Metro IVF.
How does a woman know whether her ovarian reserve is decreasing?
She can suspect that her ovarian reserve is decreasing if her menses become irregular or scanty. And if she has no menses for a year, then her ovarian reserve will be 0. She can confirm it with a doctor who will do an ultrasound to determine the number of eggs that is developing in both the ovary each month. If the count of eggs is less than 5, then she has poor ovarian reserve. If between 5 to 10 is average and above 10 is good ovarian reserve. Alternatively, she can do a blood test to measure her anti-mullerian hormone. The higher it is, the better is her ovarian reserve.
Mix FM Snapshot for Metro IVF. Mix FM Snapshot with Dr. T. Sweet Peng, fertility consultant from Metro IVF.
Now, the quality of eggs depends on the age of the woman. Would it be reasonable to freeze the woman's eggs when they are young for later use?
Yes, egg freezing will preserve her fertility and is used for her. It's used by those who want to delay her childbearing or because she has some disease like cancer which requires treatment. It is best done when she's young and at her prime reproductive age. She will have many injections to stimulate the eggs. The eggs are then harvested and immediately frozen. Many years later, when she's ready for pregnancy, we will thaw the eggs and fertilize it with the husband's sperm and then transfer it into the uterus.
Mix FM Snapshot for Metro IVF.